Okay. Couple announcements. You might want to keep in mind the 23rd of this month, where there's going to be a blood drive. We'll give you more information about it later. And it occurred to me I should issue you a challenge. So I'm trying to zero in on my 10-gallon mark of donations. These days, you can only donate 6 times a year, so it takes a while, right? But I didn't start till my 30s. So here's a personal challenge. See if you can get to the 10-gallon mark, right? You start in your 20s and piece of cake, right? So I guess it's 80 donations because each donation's a pint. Anyway, um, and and to give it more of a pitch for it, now the Red Cross has an app for you that where you schedule and all that, and then it keeps you informed where the blood went, right? Your blood has been processed. Your blood arrived in a hospital in Toledo or wherever, and your donation was given to somebody. And my understanding is they're good enough at storing it that they never throw any away, right? So it's and there's always a need. So if you're not a donor already, think about doing that. In the meantime, who's got a joke? I've been excellent. Okay. I feel like I've been picking on the left side, so I was gonna walk over there and try to persuade someone. Okay, nice and loud and slow.
This one's Halloween themed.
Excellent.
Why don't witches wear panties?
I I've always wondered that. Why don't witches wear panties?
To get a better grip on the broom.
I One could dispute that idea, right? But okay. I mean, no, I can't go there. Okay. Thank you. I appreciate that. I hadn't heard that one before, so that's good. So, I'm done talking about sexual differentiation, but before I go on the next topic, any questions about sexual differentiation? Someone had a good question about male pattern baldness. No? You're good? You understand it all now? Each of those intersex phenotypes we talked about, we'll return to them when we talk about sexual orientation because each of them offer clues to whether there might be prenatal influences on human sexual orientation. And we'll touch on that a little bit today as well. What I'm talking about today is gender, chapter 5. And I feel like I have to start out by saying that this is a controversial topic. And um, there are some things I know, right, and some facts I can share with you, but the biggest issues have to do with what society ought to do, et cetera. And I'm no more qualified to discuss that than anyone else. So as I talk about these things, you know, uh, by all means, ask any question you want. And I feel strongly that the university is the one place where anybody ought to be able to express any opinion and be treated respectfully, right? Uh, doesn't always happen, and I don't know anywhere else where it happens. And so I'll just warn you that whatever you think about these topics, there are people who disagree with you, and they're not evil people. And um, one of the things that's happened in our current discourse politically is a new phenomenon. I can tell you, I've been around probably as soon as you were old enough to start paying attention to politics, you probably notice how much name calling and demeaning there is if people have different opinions. And I'm telling you, that's new. That never happened. That began relatively recently, just in time for you to start being politically aware. And it's totally counterproductive. It's totally bad. And in terms of issues about gender, um, I just want to point out that it's easy, and especially now that we live in the attention community, attention economy, where there are all these media platforms where people can express really strong opinions and be really hurtful to other people, it's dead easy to hurl an accusation. You're transphobic, you're sexist, you're homophobic. That's dead easy. And as soon as you label someone that way, because of the power of media, Other people are going to think that you know what you're talking about and that it's true. And and once that label gets slapped on someone, it's almost impossible for anyone. How would you, if someone said, "Oh, you're a racist today," how would you prove that you're not? Right? If someone said you're a sexist today, there's no way to prove that you aren't, right? Once the accusation's out there, you can't get rid of it. So let's all please give each other the benefit of the doubt, including, those people who aren't in our classroom today, but have ideas about this topic. Questions? Anyone? Okay. So here's some of the things we're going to be talking about, many of which are controversial. First, we'll talk about gender dysphoria, when a person is made unhappy because of the gender that they've been assigned. We'll talk about the ways people transition from the gender that was assigned to them at birth to another gender. And we'll talk about several different pathways for trans women. And we'll talk a little bit about the treatments, hormonal and surgical, that people use to make their bodies come closer to what they think their proper gender should be. And we'll talk about a controversial topic of how many people begin down the pathway becoming transgender and then change their minds. Sometimes going pretty far down the pathway and changing their minds that they don't want to transition to the other gender. And such individuals are known as referred to as detransitioning or detransitioners. And it's controversial in some circles about whether such a thing exists. But I'm telling you, you can find lots of people who tell us that is their experience. And as far as I know, their experience is as valid as anyone else's. And another controversial topic we'll talk about is rapid onset gender dysphoria, where people who never expressed any unhappiness with their gender before suddenly, guess what, tends to be at adolescence, suddenly start feeling gender dysphoria. And again, there are people that dispute there's any such thing. Okay, so now you see where the controversies are, the landmines that I've just laid out. So let's talk about them. And again, having said all that, I still want you to ask any question you want. And if you hear me saying something you think is doubtful, I want you to speak up, right? Wait a minute. Oh, and I was say, rather than accusing someone of being transphobic, that doesn't mean you have to be quiet. But you can get at the same issue because you can say, instead of saying you're transphobic or you're homophobic or whatever, you can say, well, I'm not sure that sounds fair to trans people. How, and then you have to say whatever it is you have to say, or I don't, you can discuss these things in a rational and mature way without calling anybody names. I know. Yeah. Okay. Off my soapbox. So we live in a society that has big ideas about gender and how people should behave based on the sex they were born into. And you don't need me to tell you about that. But I want to be specific about what I mean when I talk about gender. So in this class, I will define sex as a biological factor, right? So, and the fact that there, in my opinion, there are only two sexes among humans is based on an evolutionary perspective. We've talked about how the life on this planet evolved, and in every animal that's existent today, each individual either produces a tiny gamete called a sperm or a big gamete called an ovum, and in hermaphroditic species, some individuals produce both, right? And that's a biological fact and a legacy of our evolutionary history. And I just can't get away from it. And I tell you that because you know that even though at the population level, there are two sexes, we've talked about individuals who have one part of their body might be female and the other part be male, right? And yet those two categories, that's our evolutionary legacy. And I don't see how we can ignore it. On the other hand, gender is, and here's the warning I want to talk about. is, yeah, we've already said that people with disorders of sex development may have some parts that are male, some parts are female. And I would even go so far as to say that if you really looked at every characteristic and measured it carefully enough, there might be no such thing as a given individual who is masculine in every regard, especially if you expand that out to psychological variables, right? I mean, the odds are unlikely. And yet still, you can still say at the population level, these are the two sexes we're stuck with. On the other hand, oh, and there's lots of reasons why you want to know someone's sex if you want to provide them with good health care, right? There's no point in giving a prostate exam to someone who doesn't have a prostate, right? There's no point in having doing pap smears for people who don't have a cervix, right? That would be malpractice. So I'm going to make the case that knowing a person's sex might be important for example, healthcare providers. But I'll also make the case that knowing someone's gender is actually of no concern to any governmental body. Why should they care what your gender is? They're not providing you health care. So we'll see if I convince you. Gender, on the other hand, is a culturally constructed idea of how people should behave based on what sex they are. And while we know from evolutionary history there are only two sexes, we know from cultural history that some cultures have more than two genders, right? So we'll talk about some of those examples, cultures where there's, more than two genders. Now, I sent off a commentary making the same points I just gave. I sent it out on the very day a professor in Texas got fired for suggesting there might be more than two genders, and defied the presidential order that says there are only two sexes and there's no such thing as gender separate from sex. Okay, but in terms of historical and cultural analysis, that's simply not true, right? So here's where I can tell you, no, there are plenty of cultures that have more than two genders. We'll talk about two where there's three different genders. And I would say that theoretically, you could have a lot of genders in a society, and it depends not just on what genders individuals feel they identify with, but it also is going to be somewhat limited how many genders can a culture maintain and think about, right? And really come to see as being somewhat distinct, especially when you realize all of us have gender characteristics of the sex opposite the one we were born to. And yeah, so I'm putting on notice, I'm not listening to orders about this. And I would say that in our society, because there are at least two genders, that virtually everyone in society is part of the gender police. We are busy policing people about how they should behave based on their gender as soon as they come out. There are some famous experiments that no one even bothers to do anymore because they all showed the same thing in the 60s and 70s, which is you hand someone a newborn baby and you say, oh, will you take care of Jane for a little bit? And they will, if you say this is Jane, they will look at the baby more straight in the face. They'll talk to the baby more. They'll be much less likely to move the baby around. If you give the same baby to people and say, take care of John for a while, they behave quite differently. They don't talk to the baby as much. They don't look the baby in the face as much, and they move the baby around more. So already our society is telling people how that kid should behave, based on whether there's a penis between the legs for the most part. And it's pervasive. And one idea of gender police that you know about is this idea that girls are put in pink and boys are put in blue. And you might think that that has some biological basis, but it's totally culturally defined because before 1940 or so, there was no consistent idea about which color went with which kid. And you can find sources going back to Victorian times that says pink is such a strong color, it should only be applied to a boy. You should never give that to a girl, right? So these are just cultural ideas that are out there, but by golly, people enforce it. And the other thing that's going to be an issue here. We need to understand that in our culture, at least, the gender police are much more vigilant about boys who don't behave like boys than they are about girls who don't behave like girls. It's okay for a girl to wear blue, but people don't want boys to wear pink. It's okay for girls to have what used to be a masculine name, like names you think of are feminine, used to be applied only to men. Kim, Ashley, those are all names that once upon a time were applied exclusively to men. But in each case, once a famous woman gets to be known with that name, nobody names baby boys Kim anymore. Nobody's going to name a baby. I mean, there's still some Ashleys out there. I know some, but they're fewer because the gender police are much more vigilant about what boys can do than they are about what girls can do, which is not to say that girls get an easy life in our culture, but that's the case. So, and in other cultures, there's the same encouragement of boys and girls to do different things. And to some extent, this masculine or feminine behavior is susceptible to social influences. We know that. First of all, whether the culture encourages boys to practice shooting with bow and arrow, that's culturally specific, right? That not our culture doesn't do that so much. Likewise, although our culture does encourage boys to throw balls more than they do girls, or the idea of working with textiles. There's some cultures where that's really impressed upon girls that they should do that, but not others. And another indication that social influences matter in gender behavior is shown here. We're looking at 3-year-olds, and they're looking at a score that you can see a high score suggests male behavior and a low score suggests female. Pardon me. The score is a sex behavior score, and you can see that females who have an older brother show more of that kind of behavior than females that have an older sister, right? Just looking at these. And single females, are not as masculine, whereas boys that have an older brother are more likely to show masculine behaviors than boys that have an older sister, and singletons are in between. So clearly, the expression of these gender typical behaviors is socially malleable. Here's an example of a culture. There's several Native American cultures where there was a third gender known as two-spirit people, but each group had their own name for that. Here's a famous photograph from all the way back in 1879, and you can see there's some white folks here that have gathered some kids at a school, these Zuni Indian kids, and all the girls are sitting over here, all the boys are over there, and right in the middle is the one person who's a two-spirit person, who is neither male nor female, but a third gender. And almost always, these two-spirit people were born with male genitalia, but from an early age showed less interest in male-like activities, more interest in female-like activities. And in those cultures, these children were recognized right away, and nobody said, "Oh, you've got to go hunt like the other boys," right? Or these individuals, they kind of had freedom to do what they want, and they tended to gravitate towards feminine behaviors, and they tended to be attracted to men when they were attracted at all. For a more recent example, in Samoa, there's a third gender known as a Faafafine. And it's very much like the two-spirit people I talked about before. In this culture, there are some boys, that is, some children born clearly anatomically as boys, who from an early age behave in a more feminine fashion. And in this culture, they're recognized as being feminine. And they're regarded not as male, not as female, but as Faafafine. And when they grow up, that as with two-spirit people, they tend to be attracted to feminine pursuits more than masculine. When they grow up, they like to dress as women, like to do makeup as women, present as women, shoes as women, and they are sexually attracted to men. And in this culture, they do have sex with men. Now think about that for a minute. That means that the men are attracted to them and have sex with them. And these tend to be men who also have, girlfriends or wives, maybe families. And in this culture, it's more or less accepted that a father, a husband, might occasionally have sex with a Faafafine. Now, what's interesting too is in this culture, when they hear about in our culture, you would say these are gay men, right? In Samoa, when you ask them what do they think about gay men in America, they say, "Oh, I heard about that. Aren't they awful?" In their minds, they are not gay men, right? They are Faafafine. They are a third gender. Question about that. And it'll be interesting to see if, as mainland American culture infiltrates the society some more, whether whether these folks will continue to be tolerated. Yeah, Maya. It's a great question. I wouldn't be at all surprised if there is, but I don't know of one. And I think what's going on here is that asymmetrical enforcement by the gender police, which is because in every society, including ours, there are names for girls who like to do boy-like things, right? And it used to be tomboys, right? Or older gamine, right? But I know. And to some extent, some folks are labeling that as somewhat offensive now. So you need to know that some people think calling a girl tomboy is offensive. But you could split hairs and say, well, if society really recognized tomboys, we decided, then that might be and also recognized two-spirit boys, right? That we could have four gender. Doesn't seem so hard for me to believe. And again, why would the government need to know which you are to put in your driver's license? Oh, well, you used to have to know the sex of an individual because you could check their ID, right? And if it said male, you looked at the person and you got a clue. Except those sorts of things were always relatively easy to manipulate, and they've all been made obsolete with facial recognition, fingerprints, retinal scan. What right, what interest would an egalitarian government have in making you declare what your gender is and making you stick to it? Now, healthcare professionals, they need to know your sex because it matters, not just in prostate exams and pap smears, but in terms of dosing of various pharmacological agents. Sometimes what's effective in males is an overdose in females. And there's certain painkillers, for example, that are much more effective in men than in women. And so that's of interest. Okay, blah, blah. More questions. Great question. Oh, and I should have looked at my slide next. You could make the case that the Amazons were the opposite case, right? That they were women who were warriors. And there have been several societies, including the Vikings, where women could be warriors, where that was allowed and permitted, and apparently they were pretty good at it. It's not clear whether the Amazons described in Herodotus actually existed, but the idea is certainly there. And I think it's Herodotus who says that they were such fierce warriors and so good with bows and arrows that they would cut off one breast so it wouldn't get in the way of their arrow shooting. So gender dysphoria then is the distress that an individual feels when they feel that the gender they are identified as does not fit their idea of what their gender identity really is. And so there's several different terms we can use to talk about this. And all of them are, again, somewhat controversial. And there's sort of a shifting idea about what is and is not the right sort of terminology to use. But what we're going to do is we're going to talk about trans men as being people that were born females, or if you prefer, who were assigned the female sex at birth. And they, growing up, they tend to be tomboys. And there comes a point when they might resent the development of breasts, attracted to women. They grow up to be, you know, for some of these individuals, they, being attracted to women means that they consider themselves to be men trapped in women's bodies and not lesbians. And we'll talk some more about what's the difference between those things in a bit. And even the term trans is undergoing changes and is one where you kind of have to be careful. In some circles, you'll get criticized. It used to be that the term transgender referred to a person who was taking on the gender other than the one they were assigned at birth, but weren't getting hormones or surgery. And then the term transsexual was applied to people who, in addition to that, were seeking hormones and or surgery to better fit the gender that they felt they belonged to, the one that matched their gender identity. But there came a point when some activists in the field, and it's their feeling, if they tell you this is how they feel, you have to accept that, felt like that being called transgender was somehow lesser than being called transsexual, and that what difference did it make really if the person felt like they belonged in the other gender, whether they opted for hormones and surgery or not. They should be equal. I don't know that anyone ever meant for that to be a hierarchy, but if the people tell you that that's how they feel, then that's how they feel, and so you have to respect that. Therefore, these days, people are encouraged just to use the word trans, which doesn't give you any information about whether or not they seek hormones and surgery. It's just that they feel like belong in the other gender. Until recently, at least, trans individuals represented less than 1% of the population, even less common than gay men or lesbian women. But as we'll see, these things are changing. And sometimes people will talk about cisgender, referring to people whose gender identity matches the sex they were assigned at birth. And another way of saying that is that most people, are cisgender. Most people don't feel a discrepancy between the gender that was assigned them at birth and how they feel now. I said that these ideas are changing. If you look at various cohorts in the United States, right here in the course of your lifetime, the proportion of people who are identifying as trans is going up at a really fast rate. And here's a controversial thing I'll suggest to you, that in the course of a generation, we're seeing something that's happening in the course of one generation, which roughly speaking, 25 years, right? That sort of change cannot possibly be due to any change in the genome. So there might be other things, right? I suppose, what are some other hypotheses? How could the number of people that identify as trans, how could it change so rapidly, Maya? So there's one. Once a society becomes more accepting of it, then maybe people who otherwise would not have ever come out as trans, maybe now they'll come out. What's another possibility? Yeah. Yep. Right. So naming it is enough to make you start wondering, right? And just as And you can read memoirs of people who grew up to be gay or lesbians. You could see that for many of them, they didn't understand why they felt until they learned, oh, some people are attracted to the same sex. Yeah. So another issue, I mean, one is more acceptance means you're more likely to do that, and the other is, on the other hand, it could be that in the past you made yourself such a target that you couldn't come out. Any others? Oh, thank you. Yeah. Uh,
You're so focused on survival that you don't have the time to really explore this about yourself.
Given our present circumstance, it's easy to overlook this. You know what? Until 100 years ago or so, unless you happen to be one of the few individuals who was living in the castle and make everyone doing your work for you, you were so busy trying to stay alive that who had time or mental resources to wonder about whether they were the right gender? Just, where's supper? Yeah. Another important factor, I should have been writing these down or numbering them, is there's technology available now that was never available before, right? That's all strictly 20th century stuff. Was there another hand? Yes. Oh, yeah, she caught. Okay, I can think of at least one more.
Popular. This is a thing. And I hate to say it because it sounds very like, oh, it's not real. I'm not saying it's not real. Just there are definitely people who, they're kind of in that stage of their life where they're like, I don't really know what's going on. I don't have an identity. It's like, well, here's a group of people that seem very accepting, that seem very, and I feel like that can also cause like detransition later because they're doing it to kind of be like, I don't know what's wrong. Maybe this is what's wrong.
Yeah, well, let's just stick with transitioning for now. But yeah, I mean, if it becomes chic, a related phenomenon you might have heard of, once the stigma for homosexuality was reduced some, there was this phenomenon, you've heard about it, are high school girls who don't want to have anything to do with the dating scene, who are lesbians until graduation, right? And that way out was available once the stigma of being a lesbian was lifted. And of course, this is going to be different in different pockets. I can think of one more. How about one more that's to do with sexual differentiation? Well, I mean, there'll be people out there. Yeah, good. Hmm.
The idea of like trying to choose her career could be appealing to some to like, act more masculine or to say that they are like men.
Yeah,
That can be reflective as well.
yeah. If you're interested in engineering, to this, or you go into medicine, you want to be a surgeon. Both those fields, women take a lot of guff. Or make it broader than that. What's your guess? What's your opinion? I'll ask everyone this. In your opinion, in this culture, is life easier if you're a male or a female? How many people think life is easier in this culture if you're a man? How many people think life is easier for a woman? See, not very many. Did you have the question? No. From again. Yeah.
Line can do that because we've assigned like certain characteristics to like women versus men, even though like a woman might not necessarily be trans, for example, if she feels like, let's say she's more athletic or like, falls into more masculine characters, she could start to think like, I might be a man, even if, not because she feels internally like she's in the wrong gender, but just because she doesn't fall into society's definition of what a woman should be and vice versa.
Yeah. I mean, I think it's, or think about, I mean, that example I gave you in Samoa. If being a gay man has enough stigma, you might feel like you're better off being Faafafine, right? Because then you're not gay. you're a Faafafine. And of course they're attracted to men and have sex with men. Sometimes, they have long-term relationships as if they were married, although I don't remember whether same-sex marriage is legal in America and Samoa.
I was going to talk about this book that I saw about someone who was gay in I forgot what country, but it's illegal to be gay, like punishable by death, but it is not legal to be trans in this society.
It's not
So
illegal.
it's not illegal to be trans. So it's a story basically about someone who wanted to be with her partner but couldn't because yeah.
And there are countries and culture right now that are very homophobic, that are encouraging people to get surgery and become trans because then they've gotten rid of all the gay people. So Pakistan, places like that. Oh, we can't have gay people, but it's okay to be trans. So if you're attracted to men, start, being a woman. Or if you're attracted to women, start being a man. So, yeah. I just want to step back and say all of these social mechanisms, I just want to point out that none of them are separable. There's no way to separate one. I mean, what's the difference between there's less of a stigma and it's more chic? None, right? Those are two sides of the same coin. All these things are, and I just want to point out that it means um, that things are changing and that it's got to be cultural. The sexual differentiation thing, I thought someone might say is, you'll hear people talk maybe endocrine disruptors, maybe the same factors that are reducing sperm count in men, maybe that's somehow affecting, you know, sex differentiation early in life or interfering with hormone action early in life and making trans identities more likely. And I don't have any data to support any of these, but they all strike me as perfectly reasonable. As we talk about this some more, there's a bit of terminology that's going to come in handy for us. I did show you that slide, right? Yeah. A bit of terminology, because in many ways, what we're going to see is that a person's gender identity is in many ways totally independent of who they're sexually attracted to. So we'll meet men who decide late in life that they're trans. And some of these men are married and are still attracted to the wife and want to stay married. But other trans men are attracted to men. So they don't necessarily go together. So it's handy, and it could be confusing, right? You could find literature that talk about homosexual trans women. Okay, what does that mean? Trans women, but who are they attracted to? I don't know. Anyway, so a handy term is to refer to is one of gynephilia. Gynephilia is the sexual attraction to a woman. Gyne as in gynecologist. And androphilia is a sexual attraction to men, like androgens. And so that's going to be useful to us in both this chapter and the next chapter when we talk about sexual orientation. Okay. And yeah, questions about any of that? So here's another third rail that, each time I teach this course, I wonder, will this be the time I say something that ends up on media and, everyone's calling for me to be fired? We'll see. So another controversial topic is there are at least two different pathways for trans women that we know are out there. And we can find lots of individuals who tell us this was their pathway. But odds are you've only heard of one, because in our culture, the predominant story is a trans woman is someone who was always uncomfortable with the gender they were assigned at birth, which is to be male, right? And you can think of the Faafafine or the two-spirit people as being exemplars of that, right? They're born with male sex, but they're never comfortable with that role. And once upon a time, when they grew up, they either were in a culture that let them behave like a third gender, or they were in a culture where they were not allowed to, and they had to suppress it all their lives. And what happens in the mid 20th century is suddenly hormones and surgery are available so that such individuals can take on the role of a woman. And that's what happens. And in some cases, some of these individuals, in fact, look quite feminine and can pass as women. And that's certainly, this is the born in the wrong body pathway. And it's absolutely true that those individuals exist. And I will say that up until relatively recently, such boys have been studied, cohorts of them. There's a book, it's an unfortunate name, but it's a famous book called Sissy Boy Syndrome, where Richard Green, a psychiatrist at UCLA, followed a cohort of boys who were very feminine in their behavior. And he followed them and until long enough to see that at puberty, virtually all of them were happy to be boys. You can imagine, they discovered their penis and masturbation, right? So virtually very few of them, less than 20% of them, ever showed any interest in wanting to be the other sex after puberty. Until puberty, they might say, oh, I want to play with girls. I feel like I'm more of a girl, etc. But the vast majority of them at puberty would desist from thinking they were the other gender, and virtually all of them grew up to be gay men. In many ways, very reminiscent of Faafafine in Samoa. So that's one pathway by which some people born as males become trans women. But there's another pathway, and not only is it not as well known, but there are forces that are trying to deny it exists. But I can tell you it exists because I've known people, met people, I've read accounts of people who say, yeah, this is how I got there. And these are individuals who there's the name that's been applied to it, for better or worse, is Autogynephilia. And the idea is these are men who are sexually aroused at the idea of having a female body. They find that sexually arousing. In most cases, they grow up as boys and don't seem to have any discomfort being boys, like the modal boy. They're interested in science and engineering and stuff like that, sports maybe. And in these individuals, what happens is at puberty, they start having fantasies about wearing women's clothes. And when they're masturbating, they like to put on a mother's or sister's lingerie, and they're excited by the idea that they might be females. And for some of these men, they then start getting excited about the idea that they had female genitalia. So you can see it's this idea that for them to be sexually aroused, they have to imagine that they're women. And nowadays, they can make that transition. And many of these individuals, they grow up straight. And as I said, sometimes they marry and fall in love with women. And sometimes, they've been in a marriage for a while. There's a famous, a book I totally recommend, a memoir by the writer, Jennifer Finney Boylan, where the word autogynephilia never appears once, not once. But she describes being a perfectly happy boy and describes, starting to masturbate with, I think, his sister and mother's lingerie and finding that really exciting. Well, He never came out publicly as trans, but he kept this fantasy of being a woman. Eventually married, had 2 sons, and went to his wife and said, "You know, I really feel like I should be a woman." And in his case, it sounds like his wife was supportive, and so he made the transition. And his wife, and to some extent his sons, were supportive of that. But in most cases, if they've been married and they come out, most of the wives say, "I didn't sign up for this. This is not what I want in a marriage." And so usually if there's a marriage, it breaks up. How are you doing? How many of you had heard about this pathway to being trans women before? Almost none, right? Um, can't remember your name. Sophie, yes. Doesn't that suggest that being transgender in that instance is a fetish? I don't think I'd go that far. We haven't talked about fetishes yet, but well, what these individuals tell us is that that idea is what they find sexually arousing. Whether you call it a fetish or not, we could argue and discuss it, and whether that then boils down this need to be women. I for one wouldn't dismiss it as just a fetish. That doesn't make sense to me. And the autogynephilia, yeah. I mean, I see, but yeah. Well, I think it's good that you said that and thought about it. I think it's worth thinking about, right? But on the other hand, um, the the psychologist who came up with the term, Ray Blanchard, he was working in Toronto, and he was at the gender clinic that had to give the okay about whether trans women there would have the healthcare system pay for their surgery and hormones. Right. So he encountered several individuals as they told this story that fit this pattern, and so he coined the term. I don't know that he himself necessarily considered it a fetish, but it was clear that he thought it was very much tied up with sexual arousal in these men. Riley, did you have a question too? Or no. And and certainly part of the reason why some in the trans community don't want to talk about autogynephilia and object to it is because they're worried that it will be harder for society to accept them, because it's a very different narrative from "I was always born in the wrong body" or "I was in the wrong body from birth." And I think, yeah, I think it's possible that that would be true. But I got to say, to me, it makes no sense to differentiate the two in terms of which is better or which is. I mean, if 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 a, if a, if someone born a man comes to me and says, "I don't think I can be happy unless I live as a woman," how is that any less legitimate from "I don't think I can be happy unless I'm a woman and I've always felt this way"? Here's a thought experiment. We'll come back to it at sexual orientation. Imagine that there's a switch in the back of your neck, and it's a toggle switch. It flips up or down. And when it's in one position, you feel like the sex you weren't born into. And if it's the other position, you feel like the sex you were born into. Imagine, what right would I have to tell you, don't you touch that switch? How does it hurt me if you flip the switch? Right? As long as you don't make me flip my switch, what do I care? And we'll come back to this same idea. We're going to talk, when we talk about sexual orientation, we'll talk about considerable evidence that there are prenatal influences on sexual orientation. And for some people, the fact that something that happened to you before you were born made you more likely to have same-sex attraction, for some people, that makes it more acceptable. But I'm not one of those people. I don't care how you came to be attracted to the same sex. What if the switch made you either gay or straight? Well, it's your switch. Do what you want with it. What right would I have to tell you? You only get to live once, but you keep that switch where I want it to be? What, for my comfort? So that I don't have to feel uncomfortable? Or because I have religious beliefs that say you must not touch that switch? And that makes the, so for me personally, whether there's any biological influence on either sexual orientation or trans has nothing to do with what sort of civil rights such people should have. I don't see the connection. Civil rights questions are, if you're a gay man, how does that hurt me? What harm are you doing to anyone else? As long as you're having sex with consensual adults, it's none of my business. Okay. Oh, and here's there's a great memoir by Anne Lawrence who describes it for seven, and she's totally embraced the term autogynephilia. But your point's well taken that there's a concern about whether that's demeaning. Okay. More questions? There have been professors who talk about this topic, autogynephilia, who then have the community try to get them fired. So we'll see. Once an individual decides that they would be happier as the other gender, the process, the process, it is a process becoming transgender. It's not something that can be done overnight. And there was for a long time, the foremost body, bless you, that was trying to offer advice to physicians about transitioning was WorldPath, WPATH, and their process that they worked out has loosened a little bit in more recent years, but originally their suggestion was that a patient should not take any biological steps towards transitioning until they'd lived a year as the other gender. And the idea was, you really want to be that gender? Well, try it out and see what that's like. How are things working out in that? And, you know, it's a tricky position because some of those individuals might pass as the other gender and others wouldn't. But the idea was that during that time, they'd be counseling, getting educated, getting psychotherapy to decide whether this pathway, whether this change was really right for them. Would it really make them happier? And then only after that would they approve giving cross-sex hormone treatment, typically gonadal steroids. So either ovarian steroids for people that wanted to be women, or androgens for people that wanted to be men. And only then would they advise surgery. And it's pretty easy to see why. For the most part, the surgeries are not readily reversible. Hormone treatment is reversible, right? So if you're a trans woman, we can give you drugs that will suppress your own androgen, and we can give you estrogen and progesterone, and many of the changes will take place. But if you change your mind, if you detransition, you stop the hormone treatment and everything goes back to the way it was. Surgery, once you remove the testes, once you remove the penis, et cetera, it's really not readily reversible. And as we're going to see, the surgeries, what's really interesting is that the surgeries, it isn't possible to construct the cross-sex genitalia perfectly. And there can be complications of the surgery, there can be imperfections, and yet most of the people who undergo that surgical transition are glad they did. So even if the genitalia don't look exactly like those of other men, they're still glad they did it. Even if the genitalia you don't look exactly like that of other women, they're still glad that they had the surgery, despite the complications and things like that. So the sorts of things that can be done are sort of pointed out here. And in natal females that are treated with testosterone, if they happen to have genes for male pattern baldness, they may very well have that. Not usually wholly, because for the most part, remember, they've got two X chromosomes. So they're not likely to have two of the recessive traits for male pattern baldness. But if they did before, as long as there was no androgen around, the baldness didn't happen. And the hormone treatment in adulthood can deepen the voice. It can cause the hair in the face to start developing a beard, a heavier beard, a darker beard. It can change body fat redistribution. The clitoris will get larger, and the vagina may atrophy, partly from the androgen treatment, and also partly because the androgen treatment, because of negative feedback, is going to stop ovarian steroids, and so the vagina is not benefiting from ovarian steroids anymore. And what many of these women tell us is that once they start the testosterone treatment, they feel an increase in their libido. Some of them tell us that they also feel more aggressive. And, this may even be so, but I'll point out to you that it's not going to be easy to see whether this is in fact a response to the hormone or a placebo effect, where that's what they expect to be the response to the hormone. For the libido, at least, I think it's pretty likely that that's real. Because remember, we established, or I don't know if we talked about it yet or not, in women who undergo menopause and complain of a lack of libido, in randomized, double-blind, placebo-controlled studies, if you give them a little bit of testosterone, they report that their libido returns. And there are men who lose their testes for one reason or another. And again, in double-blind, placebo-controlled studies, the men who get testosterone tell us they feel a lot more energetic and have a higher libido than the men who are getting control. So it seems pretty likely that in our species, testosterone boosts libido a little bit. As we'll see later, the differences in testosterone, though, have nothing to do with differences in libido, as long as you've got a little bit of testosterone. For the aggressiveness, it's really hard to know. Oh, by the way, in those double-blind studies with men who've lost their testes, nobody tells them whether they're getting testosterone or the placebo, but they all know because they feel so much better. The physicians who are evaluating them may not know, but the men know. They can tell. On the other hand, for natal males trying to become more like women, wanting to transition to be women, again, you can give female hormones like estrogen, and that will take care of the androgen, right? Because of the negative feedback, the estrogen will go to the brain, tell the brain you don't need to release more GnRH, no more gonadotropins, and the testes will shrink, just like they do in men that are taking anabolic steroids because of negative feedback. So the androgen levels decline. That means that the facial hair will lighten up some. It may or may not. It doesn't tend to make any difference in their voice. But of course, much of what's gendered about voice in our culture is one that can be cultivated whether you have a male larynx or a female larynx, right? Voice, gender differences in voice, a lot of it has to do with intonation and and loudness more than pure pitch. And every larynx can, of course, produce a variety of pitches. So there doesn't tend to be much change there, but that doesn't seem to be a barrier. And some of the men tell us that they have fewer erections and they're, reduction in libido. And yeah. So there are lots of examples of, here's some identical twins, one of whom transitioned and the other didn't, which by itself tells you that genes aren't the whole story here, right? These two individuals have identical genes, and yet one of them transitioned and the other didn't. And there's the famous case of a former famous athlete who was then known as Bruce Jenner, who transitioned to become, I actually don't know, Caitlin or Kaylin, I don't know if he pronounces the T, and in a very public fashion. And questions about that. The surgeries, or examples of the surgery, here is an example of a surgical outcome of a person born as a man who wanted to become a woman. And so they used part of the penis to construct a clitoris, and if that can be done, that's helpful because, of course, that's where all the sensation is for sexual excitement, and so they're more likely to still be able to be orgasmic. And you can see the scrotum was reformulated to look more like labia, and there's even an internal vagina, which is put together from other tissues harvested from other parts of the body. The converse, here's someone that has a surgically constructed penis and scrotum. There's a weird word to describe this, in particular, metoidioplasty. And so this individual was born as a woman, born as a female, and pretty good simulation of male genitalia. Yeah.
I've heard, but I don't know if it's entirely true, that a lot of surgeons will do sex surgery even if they aren't entirely qualified because it's really profitable.
So you're saying that some surgeons might not be as good at it, but are doing it for the money. I mean, I don't know that that's a widespread problem in this kind of surgery as opposed to any other. What I know is, if you really want to make money as a physician, plastic surgery is the way to go. Just that's where the money is, and fewer complications in general than, a cardiac surgeon or orthopedic surgeon. Those things, those are harder surgeries in general, and people aren't as willing to pay for it. Anyway, and most plastic surgery is totally elective, right? I try not to call it cosmetic surgery, but often it's just intended to be cosmetic. This is clearly something a notch harder than that. And I think I have one more example here from the book. Pardon? Oh, I'm sorry. Yeah. I couldn't hear any of that. So again. Yeah.
Like that kind of surgery, are they able to then like get erect then in a sense?
It's a great question. It varies. In general, no. In general, a surgically constructed penis will not have enough corpora cavernosa to achieve an erection. And I don't know that anyone can cause them to become the penis to be stiff, but there are ways around that. So there are penile prostheses for men who, before the days of Viagra, who couldn't get an erection because of age or health problems or something like that. So there are prostheses that can be implanted into a penis so that you can make it stiff and then make it unstiff when you feel like it. And so they might have an erection. The next question, of course, is, are they orgasmic? And it varies, not from one. So here, this individual tells us they find the penis stimulation erotic, but it's not erectile. And this individual had a mastectomy, removing the breast, also opted for an ovarectomy. And, it looks pretty masculine. Here's another example of a trans man where they do have erections, though it's, not, it doesn't look like the erections of other men. But but that can be supplemented with Viagra-like drugs. So, and of course, there are some men that have penises this size, right? So, this ends up being a pretty good simulation. And as I said, depending on the surgery and individual cases, sometimes they remain orgasmic and sometimes they don't. And again, what I'll emphasize is that almost all these individuals, even if they can no longer have an orgasm, they're still glad, they're still happy with their transition. So that by itself tells you, wait a minute, what do I care whether you wanted to transition as a woman because you've always felt that way or you felt that you learned that lately? You know the risks and you decide to do it anyway. That tells me this is really important to you. You've really judged that this is what you need to do to be happy. And again, I say it too often. As far as I know, you're only going to be here once. And so why shouldn't you try to do the best you can to be happy? But there are people who go down the pathway and later regret it. So known as detransitioning. And that's, it's not easy to know what proportion of people who go down that pathway detransition. There's a fundamental problem, which is once people start down the transitioning pathway and then change their minds, they stop going to see their doctors. And so it's hard to get the data on this because at a gender changing clinic, patients who detransition, they may have no more contact with them, may not know that they changed their mind. So I don't have any statistics I regard as reliable as to what percentage of people detransition. Questions about that? But we know it happened, right? There existed. Here's some existence proofs. These people started down that pathway and then changed their minds. And, some, depending on how far down the pathway they went, they may or may not be able to totally reverse what happened, right? If you had a mastectomy, well, yes, you can get plastic surgery or cosmetic surgery to have breasts again, but it won't necessarily be the same, et cetera. Hormone treatment, for the most part, that can be reversed. So it happens. And here's an example someone who transitioned as a man, clearly didn't have all the surgery involved, but would later change his mind and become her and have 3 kids. So clearly this person didn't have the surgery to remove the female reproductive tract. So all sorts of variations, all sorts of possibilities. So let's take up then 3 controversial topics in a row. One is the rapid onset gender dysphoria, which was first described in 2018 in a study by a psychologist named Lisa Littman, who noticed in her community that there were sometimes pockets of girls who announced they were trans, that they felt like they should be boys. And because in some cases, these were girls who knew each other, and girls whose parents and teachers and sometimes even themselves report never having been unhappy with their gender before, happens suddenly. Number one, it sure looked like they got these feelings right away, all on a short amount of time. And number two, that maybe they were socially influencing each other to be trans. And for all the reasons we talked about before, right? If you think, if you find yourself growing up in a sexist society where women get a raw deal so many places, it's got to look good to be a guy, right? The Guevadoches, if they have the chance to become men, well, why wouldn't they? I mean, it's yeah. So, so her suggesting that that was a possibility, that it could be possible for young girls to be suggestible, to be thinking that they might be trans when they might not have otherwise, social contagion, that caused a firestorm. So the trans community tried to get her fired. The American Psychological Association, which published the report in one of their journals, which went through all the same review process as every other paper they published, they ever published, they officially cast doubt on the study under political pressure. So it's a hot button issue. What we do know is there are plenty of women, plenty of people who, as girls, start to transition as guys and then later change their mind. That's a fact. I mean, that I can tell you. Girls who never showed any interest in transitioning before suddenly do. And it's always possible that they always felt that way and they just kept it hidden. But at least some of them know that this was a pretty new idea. And then change their mind, detransition. Another controversial topic is whether trans athletes should be allowed to compete against individuals, the gender that they identify with. And as always in these things, the biggest focus is on individuals who are born male and want to compete against other women as trans women. So there's several things I'll point out here. One is that there are certain events, especially at the elite levels of athletics, certain events, sprints, and particular races, not all, but some, and swimming events and things like that, where the top record holders that are men, there are no women that get it, whose scores and times get anywhere close to that, which certainly suggests that there's some biological advantage for having grown up male, that it gives the body some advantage in certain athletic events. And so the concern is that if such an individual decides that they are now female, that they will have an unfair advantage in athletic contests with other women or other girls. We've already talked about, in some cases, some of these individuals are not what we would think of as traditionally being trans, but they are individuals with disorders of sex development who have some masculine characteristics, like castrosomania, who has higher testosterone levels than others. And then there's always a question of how do you determine what someone's sex is if you're going to do this? Women with CAIS, they have a Y chromosome. Does that mean they can't compete with other women? Well, we could talk about that, but one could argue. And I think it's interesting that no one's that concerned about trans boys competing with other boys. But I'll give you a thought experiment. So in certain events like swimming, having long arms is clearly a big advantage in swimming at the elite levels, right? The longer your arms, the better you are at getting fast times. And there's a sex difference at the population level in the ratio of the long bones of the body. So that on average, men have longer arms for the body size than women do. So if you found a woman whose arms were much longer than that of other women, whose arms were basically sort of at the high end of what men have, would you say she should not be allowed to compete against other women in swimming because she has some characteristics that are outside the usual bound of women? There's no right answer to that, right? But it's pretty similar to someone raised a woman, reared a woman, always regarded themselves as a girl, who happens to have high testosterone levels because of what her adrenal glands are doing. Should she be allowed to compete with other women, or should she be excluded? And what makes it a thought experiment is I'll point out to you that at the top levels of athleticism, so you would say, oh, the woman with high testosterone, she shouldn't be, she's too strange. There's so, that's not right. That wouldn't be fair. But at the top level of athletics, they're all strange. None of them are ordinary people. They all got some genes that if it didn't make it easier for them to be in that event, gave them the motivation to practice harder than anyone else, right? I mean, they're all outliers. They're all strange. It's just testosterone happens to be something we can measure easily. So, question. You got to have questions for me. Well, out of the frying pan into the fire. Even more controversial is what to do about children who present with gender dysphoria. And we'll talk about this next time and wrap it up. But I'll give you some statistics. In the days when Green did his study of so-called sissy boys, the percentage who transitioned to be female one day was tiny. Yet virtually all of them grew up to be gay. The latest cohort, it was a study that just got published yesterday, is looking at a later cohort of children. So previously, 80% of the sissy boys grew up to be gay men and never transitioned. In this latest cohort of all the gender nonconforming boys, only 20% of them, pardon me, it's the other way around. Almost 80% of them became trans. Right? So it used to be 80% became gay men, and now about 80% of them become trans women. Here's the question I want you to think about. Is one outcome better than the other? And if you answer right away, I'll suggest you haven't thought hard enough about it. I can assure you, I don't think there's an easy answer to that question, but it's worth thinking about. And as we try to deal with the controversy around how to treat these children. And it does suggest that one of the reasons that more of those feminine boys become trans women is because of changes in the way such children are treated now as compared to the earlier cohorts. Okay, that's all the trouble I need to be in today. We'll finish this topic up, hopefully get some conversation next time, and then we'll start chapter 11 on sexual orientation.